the unemployed and the homeless, what happens to them? They end up falling back on needing our social services. And basically, when I thought about this, and I have many patients that require our social services, Medicaid, and I realized I had a personal story, and I have to say, I realize it as if I'm trying to pull away from it. But I'm actually part of that, or part of the individuals that have been unemployed and homeless and have had to depend on our social services, also known as welfare, as if it's a nasty word. The only thing nasty about it is it's growing in this country because those who can truly make a change have decided not to make it. It's probably politically incorrect to help take care of the needy in this country. A great man, probably the greatest man, if you read the Bible at all, one said that there will always be poor. He didn't say how big that population was going to have to be. So we as men and women, if we really want to cut down the numbers, we can do that. Anyhow, I'm Dr. Savala. I do work at my clinic in Caldwell. I'm married to my lovely wife, Rosa. I have to gain some points from her, I hope. And we have 3 children. Our 2 daughters are in college and I have a son in high school. And why do I care about the current health and education systems? Because these 2 systems are inseparable. You cannot degrade or improve one without doing the same to the other. It's like saying the brain and the body are separate. They're all one system. My life experience includes a time when my family needed the help of our social welfare system. As a child, I watched my mother being questioned at our home at 1 o'clock in the morning by welfare investigators. Not a good experience for a child. But the help that was extended us was greatly appreciated. We received medical care at one of the designated clinics. It actually was fun waiting there all day. My mother would take a lunch for us. We'd play with the other kids until some of the young interns would be able to take care of our health needs. With my mother's encouragement, I became a physician. One of my siblings became a nurse, and the other 3 actually went into develop their own businesses. They were small business owners. Now there's a cost to families who go on this social service or welfare system, and it does affect the children. A few of the many questions and statements I was asked or told as a child as to why our family needed assistance included, why can't your mother take care of her children on her own? Is your mother lazy? She wants to live off the state and government. She doesn't want to work. She wants to teach you kids to live off the government. This is kind of hard for me to actually say, but how many boyfriends does she have? The worst of these comments I won't mention, but I will say these comments were made to children by individuals in positions of authority. The truth is my mother was having a very hard time financially. Even working a full-time job and 1 and sometimes 2 part-time jobs at the same time, she still couldn't make ends meet. I mean, can you imagine the 1950s and 60s? A good portion of the U.S. working force was not paid a living wage. I mean, we're still there after 50 years or more. Living wage. I mean, if we want to cut down the welfare system, the Medicaid system, improve the educational system, we have to give men and women the opportunity to earn a living wage. Medicaid budget. That's only one suggestion. Don't cut taxes. This complicates the funding of this service. How do we match federal funds if we don't have the tax revenue to match them with? Make sure that those that benefit from our public systems, highway transportation, education, water systems, and power grids, pay a little more to make sure a few of the social programs remain properly funded. Look at taking dessert away from a millionaire is going to kill him. And we're not talking about a large portion of money. 1 or 2%. They've cut my income by that much this year, and I didn't go out and cry. So why can't they do it to the wealthy? I'm not a millionaire. This is sincere. This is an easy one. It won't be done. Consider term limits for the legislators. Now, how about this one for a joke? Limit the influence of lobbyists. So, in summary, relative to Medicaid and the educational system, the solution requires more than just cutting their budgets. And I think, ladies and gentlemen, please talk to your neighbors, Republicans, Democrats, Independents. We need to get together. Yes, this Boise, Occupy Boise, they're not our enemy. They're not the enemy of the state. They're nobody's enemy. They're people who are trying to make a living. And it seems more and more difficult for those who are elected to actually hear them or hear us. Anyway, thank you.